Thank you, Ms. Hancock. And now I'd like to invite a speaker like Karen Bass to come forward. Thank you.
Thank you. Good afternoon, everyone. It's my pleasure to be here with you today, and I want to thank Mr. Garcia for welcoming us into the clinic, and especially your representatives, Mary Hayashi and Loni Hancock, my two colleagues that I really am delighted to serve with in the legislature. And Loni will be shifting over to the next house pretty soon, leaving us in the Assembly and moving over to the Senate. And so I'm glad that she took the time out to be here today. But all of you who know your representative, Mary Hayashi, you have an incredible advocate, an incredible representative who is absolutely going to fight every step of the way and who always makes sure that the rest of us in the Assembly understand the issues. And so when she asked me to come to her district, I was more than happy to take the time and come, and this certainly won't be the last time I'm here. My job here today, my mission here today, is to really learn about what is going on in this community and in this particular facility. So I am looking forward to sitting down and listening to hear what you have to say, and also to tour the clinic. And you may or may not know about my background. I was actually trained in primary care as well and spent most of my professional life prior to joining the legislature in the healthcare arena, working many years as a nurse in the neonatal ICU, and then after that moving on and becoming a physician assistant that was trained in primary care. And the focus of my clinical experience was in the emergency room. Well, the emergency room in Los Angeles County really is primary care. It's divided into different sections, and I worked in trauma, but before working in trauma I worked in ambulatory medicine, which for all practical purposes was primary care, and sometimes primary care gone awry, meaning that if the person had gone to the clinic, they wouldn't have needed to go, into the emergency room with a more acute situation. And I think it's just real critical to be here today and to talk about dental health, because for those folks in the legislature who do not have a health background, for some reason we kind of cut the body up in the sense that we don't see the relationship between dental disease and the overall health of a person's body. And I think, Ms. Hayashi gave an extreme example, which I remember very well, of the 12-year-old who literally died. But for those of us in the medical field, we know when a person has dental problems, it impacts their overall health, including diseases that individuals can catch, infections and all. And so I think that it's really, really important when we're looking at a budget, when we face a dire situation. Some people might think, well, we'll keep healthcare, we'll just cut dental, or we'll just cut vision, and it's, the whole body can't be segmented like that. And what we're facing right now is a huge budget deficit, and one of the concerns that I have, and we're trying to be very proactive about, is everybody who represents a different sector wanting to make sure their sector is protected, and not realizing that, well, we might protect healthcare, but then we cut education. We save education, and then we cut healthcare. And I think what we all have to understand, and I know the people in this room and who work in the clinic understand, that you can't separate that either. Because the kids that we're talking about educating, these are the same kids who need the health services in this clinic. If you're wealthy, then you have choices of private schools and private clinics and other resources like that. So you can't just fund one part of the child. You can't serve them breakfast and then cut lunch, because what is the point of doing that? So what we have to do this year is really band together across all the sectors and say, what type of quality of life do we want to have in California? And we have to make sure that if we want the services, if we want a high quality of life, that we're prepared to do what we need to do in order to have that. And that certainly does not mean passing a budget that has across the board 10% cuts. So I'm happy to be here with you today. I'm looking forward to learning about what happens in this wonderful clinic and doing anything I can to support you. Thank you.